This time, Dr. Tom Fletcher is baffled by a terrified traveller.
I said, you know, we may not get an answer for this.
I'm not really sure what's actually going on, none of the doctors know.
Dr. David Lalloo hunts deadly snakes half a world away.
Certainly can kill you.
Yes.
You're getting far too close to the comfort.
And Dr. Laura McGlynn battles a gruesome body invasion.
I imagine them sort of swimming around under the skin, sort of thing, munching away.
Can cause seizures, hearing loss, double vision.
This crack team wages war on deadly bites and alien body invasions, battling lethal infections from around the globe. Only they stand between you and bugs, bites, and parasites. Here at the legendary Liverpool School of Tropical Medicine and the Royal, an elite team of super doctors investigates medical mysteries. From parasite infections to venom injections.
You can just see the fangs there.
Professor of Tropical Medicine, Dr. David Lalloo, is renowned for his knowledge of deadly snake bites.
People thought I was absolutely mad when I went into tropical medicine. I was at a fairly well-known London teaching hospital doing a standard job, and the idea that you would give that up was just thought to be mad by most people.
When not in the field, David is dedicated to teaching the next generation of doctors doing battle with tropical infections.
I recently treated a guy who was force-feeding his own pet cobra by sticking mouse sandwiches down its neck.
From snake bites to worm infestations, junior doctors studying David Lalloo's specialist field are thrown in at the deep end. This is Dr. Laura McGlynn's first week tackling bugs, bites, and parasites.
There's a lot of conditions that I've never really managed before. Lots of drugs we've never prescribed or used before, so there's a lot to learn, I think, really, from this.
Laura McGlynn needs to learn fast. Her next patient is having a relapse from the disfiguring parasitic disease, Leishmaniasis. Charity worker Wendy Queen received treatment 9 months ago to kill her infection. But some parasites survived and continued to breed inside her.
I have got this awful imagination. I imagine them sort of swimming around under the skin, sort of thing, munching away.
Leishmaniasis is caught from infected sandfly bites. Parasites enter through the bite to cause skin lesions and ulcers. When the Leishmaniasis parasites entered Wendy's body, they were attacked by her white blood cells. But the parasites didn't die. They replicated in her before bursting out and infecting more cells.
I could actually feel this sort of like, not exactly tickling sensation. I don't know how to describe it really. But in my mind it was these things swimming around. Hundreds of them by now, you know, millions.
Wendy caught Leishmaniasis when she was doing charity work in sub-Saharan Africa. A dream job for Wendy, but the dream soon faded.
I felt these 2 bites. Really sharp. I thought it was a thorn actually at first.
Wendy now knows those 2 bites were sandflies, infecting her with Leishmaniasis.
By the time I got back, it was just getting more and more swollen and spreading, so, you know, getting larger.
Laura McGlynn is eager to see this unpleasant disease firsthand.
I've not seen a patient with Leishmaniasis before, so this will be quite interesting for me. Something I'll probably go home and read up about as well.
Do you want to see?
Yes, please. That's okay. Okay, so it's just here, the lumbar region. Okay, and there is some scaling of the skin over the top.
Wendy has what's known as cutaneous leishmaniasis. If left untreated, this strain continues to break down tissue around the site of the bite, forming expanding, weeping ulcers. With the help of her senior consultants, Laura McGlynn is determined to put an end to Wendy's body invaders.
It sounds a bit unusual, doesn't it? He's got a few swollen lymph glands after a sting.
Yeah.
Dr. Tom Fletcher is also finding his feet in tropical medicine. The British Army medic has tours of duty in Iraq and Afghanistan under his belt. Now he's come to Liverpool to learn from the best in the business.
If you've got something rare and interesting, people want to see that and learn more about it.
We're the well-travelled clinic.
Today, Tom Fletcher's on call at the Tropical Schools Referral Centre. He's investigating a tough case with the aid and expertise of Dr. Lalloo.
It's a young lad who's got ongoing symptoms, is what the letter says, so you wonder whether actually needs an inpatient admission. Yeah, exactly.
Management Studies student Ryan Stock has returned home from a 2-week holiday in Africa. Insect bites have left him vomiting, sweating and exhausted.
My whole body really aches. Anything I do, I just get shattered straight away. Can't sustain activity for very long.
Thousands of illnesses share Ryan's symptoms. From tick typhus to trypanosomiasis. The most likely is malaria. This global menace kills 1 child every 30 seconds. Once diagnosed, treatment can destroy the parasite. But in Ryan's case, initial tests have ruled out this killer.
I've been confirmed that it's not malaria or any glandular fever, so that's why I'm not really sure what's actually going on. None of the doctors know from my blood results either.
Diagnosis is in the detail. Tom Fletcher's line of questioning must start from scratch.
Hi, it's Ryan Stock, is it?
Yes.
Hi, do you want to come through?
Sure.
Ryan's brought his mum Hazel along for support.
Thank you.
Hiya, nice to meet you. Please grab a chair over
Thank
here.
you.
Hello, hiya. So what we need to do is go through the full story, really. And what were you doing whilst you were away?
In Tanzania, I climbed Kilimanjaro.
Okay, how was that?
It was amazing.
The summit of Kilimanjaro and a safari were the highlights of Ryan's dream trip. But since returning, he's been in and out of the doctors.
Did you get bitten much whilst you were there?
I got about 5 or 6 bites. I got a fever and my head was pounding the whole time as well.
Okay.
And then I was sick a few times.
Okay, and how long did that go on for in total, the fever?
Probably 2 weeks, yeah.
It's unusual to have hay fever for that long. On a walking safari, occasionally you can get unusual type of bites that can give you sort of illnesses that you only acquire abroad.
Tom Fletcher suspects Ryan's African safari is the cause of his mystery illness. But there are many potential culprits, from insects injecting parasites into the blood to worms that burrow into the skin.
Got a bit of a tantrum in a way as well, haven't you? Swing these legs around.
Tom Fletcher has to run tests to find out what's flattening Ryan. Coming up, Dr. Laura McGlynn preps Wendy for treatment.
It can affect your kidneys, diarrhoea, headache, make your heart go into an abnormal rhythm.
I'm going to be honest, I feel quite scared.
And David Lalloo takes to the tropics in search of snakebite.
There's a kid in the pediatric ward who's got a bite.
At the Well-Travelled Clinic in Liverpool, specialist registrar Dr. Tom Fletcher is trying to uncover what war is being waged inside his patient, Ryan Stock.
And then there's definitely no other marks on your legs at all, or rashes, nothing like that at all to see. Okay.
Malaria has been ruled out, but there are many more tropical diseases it could be. Tom Fletcher's senior consultant, Dr. David Lalloo, wants to know how the investigation is going.
So he's a 19-year-old who's normally fit and well. and was well the whole time he was there and pretty careful with food and water hygiene.
That sounds quite unusual, really.
No, as he said, he was quite a model kind of...
Doesn't really sound like a typical traveller at all.
No, not exactly. He started to get high fever, sweats at night, lethargy, a bit of a sore throat and a few swollen lymph glands. So I've explained to them, hopefully we'll get an answer,
What's your
but
bet?
we may not. Qfever.
Known as query fever, this rare infection of Coxiella burnetii bacteria fits with Ryan's symptoms and travel. Transmitted by ticks biting infected animals, Ryan could have caught Qfever on safari in Africa. In the past, many illnesses like this were mistaken for malaria.
The fascinating the way it's evolved, isn't it, that it's not malaria anymore, so what is
It
it?
is. And it's a real issue, actually. It's made a real problem.
Ryan's blood is sent to be tested, but it will take time to trace this tricky infection. In the meantime, Tom Fletcher isn't taking any chances. He prescribes doxycycline, a powerful antibiotic capable of killing a plethora of parasites and bacteria, including those causing Qfever. Ryan's age is his asset. As a young adult, Dr. Fletcher expects him to make a full recovery. For boss, David Lalloo, there aren't enough hours in the day. His medicinal mind is constantly called upon to battle parasites.
It sounds like it's most likely to be an ascaris. So that's a roundworm, basically.
And snake bites.
Professor David Lalloo saved my life, and I'll always be in debt for him for that.
David is one of the UK's foremost snakebite experts. His interest was sparked as a young man in the tropics, dealing with the devastating effects of venomous snakes.
I started off by working in Papua New Guinea, and 25% of the beds were occupied by snakebite patients. So my research just logically extended from the challenges of caring and looking after those kind of patients.
Worldwide, snakes cause as many as 94,000 deaths every year. Among the most feared are taipans, mambas, krites, Russell's vipers, saw-scaled vipers, and cobras. 4 of these killers call Sri Lanka home.
Sri Lanka is one of the highest snakebite burdens in the world.
Professor Janica De Silva has spent 20 years investigating the deadly results.
The official statistics say that there are about 37,000 snakebite victims who are admitted to our hospitals island-wide every year.
Tourists can avoid risky areas, but if you live and work here, that's not an option. So Professor De Silva and his team are trying to help.
We are now performing a truly national survey of snakebite, trying to make a risk map of snakebite.
Using this data, the research team in Sri Lanka target areas where snakebites occur and provide anti-venom to the people who need it most. David Lalloo has been collaborating with Janica for over a decade in his efforts to reduce snakebite numbers on this tropical paradise.
What he sees in England are probably bites in handlers or people who work in zoos and so on. So the real snakebite burden, for him to see that, he has to come out to the tropics. Hi, David. Nice to see you again.
Really great to see you. How are you? Well,
Fine, yeah.
excellent.
And you?
Fine, actually. How's things here?
There's a kid
Okay.
in the pediatric ward who's got a bite. I think we could see him.
That would
No
be
adult.
really,
Yeah.
really interesting.
Schoolboy Damindu Uresh was rushed to hospital when a snake bit him on his ankle while he was playing. Damindu is showing signs of venom in his blood. His father knows just how serious this could be.
විස නගින එක වැඩි වෙනවා එතකොට. ඉතින් හොඳටම බය වුණා. ඉතින් මේ මොන තත්ත්වයක් උදා වෙයිද දන්නේ නැහැ කියන හැඟීම ඇති වුණා ඉතින් මට. ඉක්මනින් ඉස්පිරිතාලේ ගෙනිච්චාම බය වෙන්න දෙයක් නැහැ නේ කියලා හිතාගෙන තමයි ඉස්පිරිතාලේ ගෙනිච්චේ.
Snakebite is a major problem for children because the snake doesn't differentiate when it bites somebody whether it's a child or an adult. And so the snake will deliver the same amount of venom to a child as it will to an adult, and proportionally that venom is at a much higher concentration in a child than in an adult. And so therefore the consequences of snakebite in a child may be more rapid and they certainly may be more severe.
This is David Lalloo.
Hi, good to meet you.
David Lalloo's keen to establish the level of envenoming in Domindu's small body.
Can we just ask him to look at my finger and keep looking? So I was just wondering whether it would fatigue or not. Thank you. That's all right, thank you. Can I just feel in his groin, will you mind? Okay. It's all okay, yeah. It's very tender, absolutely, yeah, absolutely. Which I think is always a really early sign of envenoming. On this view, the ankle is quite swollen, isn't it? If you just comparing to the other side. The earliest signs of snakebite is the swelling and damage at the site of the bite. The skin can actually necrose, it can break down, and you're left with a great deal of severe damage, and in some species, leading to amputation.
To combat this, the team administer anti-venom. Now it's a waiting game to see if this is enough to reverse the venom's effect on Domindu. At the Royal Liverpool, junior doctor Laura McGlynn is working to rid her patient of a disfiguring infection. 64-year-old Wendy Queen has spent nearly 2 years suffering from Leishmaniasis, a parasite capable of creating lesions all over the body.
I was just thinking of them as being mosquito bites at the time. Stupidly, I went on the internet and read everything and really frightened myself.
90% of cases occur in Asia, the Middle East, Africa and South America. But this insidious organism is on the rise and is now spreading into the United States. Wendy is harboring thousands of these parasites. New to tropical medicine, Laura McGlynn is hitting the ground running. Working with her colleagues, she's rapidly getting to grips with Wendy's condition.
Leishmaniasis can be serious if left untreated. Her symptoms had relapsed, and that's why we brought her in for further treatment.
Wendy now faces a daunting ordeal. The antifungal drug, amphotericin, is nearly as deadly as the disease itself.
In terms of the side effects, you can get a bit of pain in your stomach, okay, yes. Diarrhea, headache, it can affect your kidneys, it can sometimes make your heart go into an abnormal rhythm, okay, hearing loss, double vision, can cause seizures. Occasionally, people may have an allergic reaction to it.
Does it happen straight away, or?
If you were, for instance, if you're going to have an allergic reaction or an anaphylactic reaction, which is a very severe reaction, we would notice within quite immediately. If you feel you can't tolerate it, you just need to let us know.
Okay, yes, okay, thanks.
Is that okay?
Yeah.
Okay.
At the moment I feel quite nervous, I'm going to be honest. I feel quite scared. I just want it over and done with. I just want rid of it. I want to get better.
Staff nurse Maz Hoyle is administering this toxic remedy.
Hello, you okay?
The amphotericin will be drip-fed into Wendy's bloodstream.
How long does the whole drip take to go?
The whole drip takes, I think they want you to have it over 3 hours.
3 hours? Oh,
yeah.
That's a long time.
Yeah. But
yes.
if there's any problems, just give me a shout.
I will do, yes. It looks nasty, doesn't it? It looks as if it'll kill me.
Wendy hopes she'll make it through this demanding treatment unscathed, finally ridding her of the parasite. But during the night, Wendy's body started to react against the drug, and the dose was cut short.
I was very worried, actually, because since the nurse was very worried. They kept asking me if my tongue was swollen. It had swollen up all round there, and in the inside it was going numb and then starting to come around there.
Wendy managed 2 hours and 50 minutes of her 3-hour treatment. She hopes this will be the end of her leishmaniasis.
Well, it would be 2 years in April that since I was bitten, since I was in Kenya. I came in here thinking, this is going to really just knock it out now. It would be beautiful if it was over.
After discussing it with the powers that be, Dr. Laura McGlynn is confident this dose will have done the trick.
She doesn't actually require any further treatment now. We think that this one dose may have been appropriate enough.
Wendy can hope for a parasite-free future. Coming up, Dr. Bertie Squire tries to uncover the cause of a mysterious infection.
There's a hazard to this and we don't do it lightly.
Bit worried what's going to happen.
And David Lalloo investigates the power of snake venom.
Completely clotted.
The team at the Liverpool School of Tropical Medicine and the Royal confront the weirdest and rarest diseases on Earth. There's not much these doctors and scientists haven't seen. Dr. Bertie Squire specialises in tropical and respiratory diseases, conditions which can be stubbornly hard to pin down.
Diagnosing an illness is a mixture of putting together a jigsaw puzzle and a detective story. It's trying to find a thread and an explanation.
Bertie's next patient is just such a medical mystery.
Dr. Ashraf, do you want to come through?
Yes.
Bertie needs to draw on all his experience to diagnose his patient's unusual symptoms. Radiologist Dr. Tausif Ashraf spent 26 years living in India. 16 years later, he's suffering from fevers, an inflamed heart, and fluid building up around his lungs.
If we could focus on February this year. You remember feeling feverish at the time?
And the night I couldn't sleep, I was drenching with sweats.
Okay. And no cough at any stage?
Off and on, I do have cough, and I do get some speck of blood in it.
Coughing up blood is a symptom that is a danger sign. That's a definite alarm bell and prompts a whole series of further questions, really.
It is very worrying, especially from coming from a medical background, working in medicine, not knowing what is the cause of it. I don't mind even if it's something which is non-treatable or whatever it is. We want to know why this had all happened. And the quest of coming over here and meeting Bertie was to find out.
Dr. Ashraf's scans are sent to consultant radiologist Dr. Liz Ukis, who specialises in images of organs infected with tropical illnesses. Dr. Ukis detects sinister signs in Dr. Ashraf's lung.
If you compare his left side here with the right side here, that something's going on down here. And what's happened is that he's got fluid sitting below his right lung, and the lung tissue next to it here, this brighter part here, is actually abnormal lung tissue.
Bertie needs to work out if this is a tropical infection spreading through Dr. Ashraf's lung. Over 8,000 kilometres away, in Sri Lanka, snakebite expert Dr. David Lalloo has his own mystery to solve.
It's difficult to work out sometimes exactly which snake has bitten the patient.
There are 5 highly venomous snakes native to Sri Lanka, from Russell's vipers to cobras. These killers bite humans when they feel threatened. It's hard to know which is responsible for 8-year-old Damindu's bite.
So was he able to say how big the snake was?
Yes.
So this is most likely Russell's viper, isn't it? One of the really potentially catastrophic consequences of Russell Viper's bite is the bleeding that comes because your blood's not clotting normally. And so people can die from bleeding into the brain or because they've got catastrophic hemorrhage from the gut, for example. And so it can really be a very unpleasant syndrome.
This is the Russell Viper, who's responsible for most severe envenoming in Sri Lanka.
Right.
Anjana Silva is an expert on Sri Lanka's venomous snakes.
Russell Viper bites are most medically important and the bites that lead to devastating outcomes.
This Russell's Viper is being milked to investigate the power of its venom. It's a chance for David Lalloo to put theory into practice.
We know that Russell's Viper venom contains a quite powerful protein that activates clotting, so that means that it makes blood clot.
David is curious to see how quickly the venom clots some of his own blood.
15, I think.
I was not expecting David to give blood for this test, but he was so generous. And
You've done this before. Good, so we see what happens, shall we?
David Lalloo is separating his blood into two containers. One will have venom added to it. The other will be left untouched.
So just add the venom and see what happens. Great.
The venom doesn't take long to work its deadly magic.
So that's a minute gone by now. You can compare the two here. That's the one with no venom in, and that's the one with the venom in. Completely clotted. To clot that blood incredibly rapidly just shows you what can happen when these venoms hit an animal. Of course, if that happens to a mouse, then it's going to drop dead instantaneously.
The scale of the venom's effect is surprising, even to these seasoned snake experts.
I was not expecting
No,
this.
we didn't. In a human, because they're bigger, the effect of the venom is to use up the clotting proteins, and that means the blood simply won't clot, even when it needs to.
Unable to produce additional clotting proteins quickly enough, the blood in a human becomes increasingly thin.
That leaves patients at a real risk of severe bleeding, maybe into the head or from the gut, and unfortunately that leads to fatal consequences.
In Liverpool, Dr. Bertie Squire is striving to solve an unexplained illness affecting his patient. Indian-born Dr. Tausif Ashraf has been admitted to the Royal. His lung wall is filling with fluid. 2 litres have been drained in the past, but fluid continues to build, compressing his lung and restricting his breathing.
Hi, Dr. Ashraf. Further on.
It's unknown whether the damage is being done by a tropical disease.
I don't know what's wrong with him at this point, but it's possible that whatever is happening in his lung could progress to a point where his health might actually get a lot worse. Things could go wrong. I'm going to go straight to the back.
Bertie thinks Dr. Ashraf might be suffering from the non-parasitic infectious airborne disease tuberculosis. Known as TB, this bacterial infection could be targeting his lungs, causing the buildup of fluid. It's rampant in Dr. Ashraf's tropical homeland, India.
It's possible he was infected with tuberculosis many years ago. TB is another of these tricky diseases where you can become infected and the infection can lie dormant. And then, for some reason, the disease can break through in later life.
The best way of knowing if it's TB will be to extract a piece of infected lung tissue. But this is a dangerous procedure to perform on Dr. Ashraf. He has afibrinogenemia, a rare disease that prevents his blood from clotting.
Bit worried of what's going to happen. Scary thing is, because of the problems that I have, when I bleed much more. I really hope everything goes fine.
The problem is that in the process of putting a needle in through the chest wall into that fluid, you can hit something else that would bleed. So even in people who have normal clotting, there's a hazard to this, and we don't do it lightly.
Consultant radiologist Dr. Liz Ukis will be inserting a soft tissue biopsy needle that cuts a pin-sized core sample from Dr. Ashraf's lung.
I actually quite enjoy this part of it. I like the procedures, yeah.
An ultrasound machine will help Dr. Ukis guide this supersized needle into Dr. Ashraf's body. Precision is paramount.
We were very worried about whether he would get a bleed from this because there are big blood vessels in that area. Okay, a bit of local anaesthetic now in the skin.
Dr. Ukis is aiming for the lung wall, known as the pleura.
With the pleura, the pleura is very painful. Tell me when you feel the pleura. Is this painful? Yes. Okay, I'm on the pleura now.
Dr. Ashraf is already beginning to bleed from the painkiller injection.
So the first skin nick bled a bit. I'm just a little bit wary of the bleeding issue. Before I proceed, I just want to make sure it stopped. Okay, first biopsy coming now. Not good enough.
Dr. Ukis needs to make this fast or risk further bleeding.
I can't promise that you're not going to feel this. Tell me if you do, because I can put more local. Is that sore? Sorry. They're very small fragments, which is why I'm having to do it several times. You're going to feel this one again, I'm sorry. I have to come out of it rather damaged. He might feel a bit bruised because, you know, when the anaesthetic wears off, the back of the chest might feel a bit bruised because you've stuck a needle through it.
With samples successfully done, Dr. Ukis takes the opportunity to drain the excess fluid in Dr. Ashraf's lung wall.
Finished. And you can now see there's less fluid because of what I've taken off.
Dr. Ashraf's sample is sent to a secure lab to test for tuberculosis. The results are inconclusive. Tuberculosis is not a disease to take risks with. Bertie Squire makes a decisive move to ensure Dr. Ashraf is TB-free.
I think we've reached a point where you should probably be treated for tuberculosis. Okay, I was going to prescribe a month's worth of rifampicin, isoniazid, pyrazinamide and ethambutol. He's thrilled. Well, he's thrilled. Thrilled, maybe not the right word, but he's pleased that we've got a plan.
In Sri Lanka, David Lalloo is preparing to help track venomous snakes.
Is it okay for you to handle this?
It's fine. Well, to behave. Snake hunting may seem like a slightly bizarre thing to do, but the reality is that this kind of expertise is critical, not just for understanding the snakes and understanding what's around, but for helping humans as well.
Snake catchers are used all over the world to harvest venom in the research and production of anti-venom. The team soon spot one of the deadliest snakes in Sri Lanka.
Yeah, we have hump-nosed.
The hump-nosed viper is responsible for more bites than any other snake on the island. With no anti-venom currently available, doctors have to treat symptoms as and when they appear.
Still, we don't have any antivenom coverage for these snakes, so it's sort of a symptomatic management in Sri Lanka.
So I shouldn't get bitten by this?
Yeah, really.
They certainly can kill you.
Yes.
Dr. Lalloo rarely sees the effects of snake bites in the UK, but his continued research and annual trips to Sri Lanka have made him an expert on hand to help at consultations.
And you've had 7 snake bites in the last few days, have you? Gosh.
Weekend was a casualty.
Professor Sisira Siribadana has had no choice but to become an overnight expert on snake bites.
After coming here, you see so much of a snake bite and poisoning, you couldn't ignore it.
And so there's another patient that you've heard about in the hospital, is that right?
Yeah, it's a great bite.
Mr. Thilakaratne is a farmer. He was bitten on his ankle at night. As his condition plummeted, a friend rushed him to the local hospital.
So according to the bystander, he developed difficulty in breathing, chest pain around 12 midnight.
Okay, so he had the drooping of the eyelids, a little bit of difficulty swallowing.
Yeah.
So he came straight to the ITU. It was recognised.
From the OPD, he was straight admitted to the
Right.
ETU. Breathing was irregular, and he has some fluid in the lungs.
So he was starting to get to that point where he just couldn't cope.
And then connected to the ventilator.
So pretty much as soon as he got here, he needed bagging, so he needed support. He was pretty lucky then, actually.
Yeah,
because got another half an hour, and he may well have had a respiratory problem on the road. Yeah. Gosh. Poor guy.
Based on severe paralysis, doctors believe the venom belongs to one of the deadliest snakes in the world, the kite. There's no effective anti-venom. Kite bites are often fatal unless a ventilator breathes for you.
Their venom contains neurotoxins, and these are toxins that specifically interfere with the normal activity of nerves and muscles.
The paralysis started in the patient's weakest muscles before spreading all through his body.
This may be in the early stages quite simple, such as ptosis, the drooping of the eyelids, or difficulty in moving the eyes. But if it affects the diaphragm, you get to the point where you have very severe problems and you may stop breathing and need ventilation.
The nearest ventilator to Mr. Thilakaratne was 40 kilometers from his local hospital in this intensive care unit. He's one of the lucky ones to make it here. In the snake-infested paddy fields of Sri Lanka, many farmers like Mr. Thilakaratne are at risk of being bitten while they're working. But the danger doesn't disappear at the end of the day. Kites become aggressive at night. On their hunt for small rodents, they're quick to bite anything that moves.
Classically, this snake tends to bite people inside huts or houses, and often while they're sleeping.
Known as the silent assassin, kites leave virtually no damage at the site of the bite.
And so it's quite possible that somebody can be bitten in their sleep, not be aware of it, and wake up with early symptoms. And sometimes people just don't wake up because they get such severe neurotoxicity that they just die.
Mr. Thilakaratne must be kept on a ventilator until the venom wears off. Coming up, 8-year-old Domindu is back on his feet. And David comes face to face with a cobra.
It doesn't look very happy.
The Liverpool School of Tropical Medicine works with scientists, doctors, and researchers stationed all over the tropics. The school's snakebite expert, Dr. David Lalloo, conducts his research in Sri Lanka, seeing patients bitten by some of the deadliest snakes in the world.
You learn from every patient you see, and there's always something different or something unusual. If you've got a lot of experience from seeing those patients in the tropics, then the UK patient benefits as well.
David Lalloo is consulting on a case where the patient is lucky still to be alive. Mr. Thilakaratne is unable to breathe for himself after a highly venomous snake, the kite, bit him on his ankle. Neurotoxins in the venom paralyzed his muscles, making him dependent on a ventilator until the venom wears off.
If he didn't come to the hospital, he would have died, definitely, because he needed that respiratory support by the machine. Without that, he would have lived.
24 hours after his first visit, David Lalloo is returning to the intensive care unit.
Hi, David.
Professor, hi. Good to see you again.
Good to see you again. The patient whom we saw yesterday is out of the ventilator.
Sure.
And on a TPs or just plain oxygen with the tube in.
So he's just struggling really just to open his eyes.
Yep.
Okay. But actually breathing reasonably well. The patient is clearly much better than he was when we saw him actually 24 hours ago now. He's actually making some movements, so he's no longer paralysed by the venom. He can move his arms and legs a little bit. And most importantly, he's no longer dependent on the ventilator, so he doesn't need a machine to breathe for him anymore. Getting here on time and getting the ventilation support, he survived, and now 24 hours later he's on his road to recovery, and in a few days he'll be back to normal.
In Liverpool, Dr. Bertie Squire's patient isn't doing so well. There have been complications with the intensive first stage of Dr. Ashraf's tuberculosis treatment.
Started on the treatment, had a bit of reaction, just started itching a lot after a week, so I was told to stop it.
Dr. Ashraf, do you want to come in?
Hi, thank you. Basically come to see whether we need to carry on with the medications which he has given.
Tuberculosis is a difficult disease to defeat. Full treatment takes a daunting 6 months.
He still has evidence of fluid clinically listening to his chest, and that means I'm very keen that he completes the full 6 months of treatment. The chances of side effects start to reduce after we get you off the intensive phase.
Dr. Ashraf decides to soldier on.
I hope it will all be sorted, and I hope is very important to have. I've still not lost hope. I still feel that if I can carry on this for the period of time Bertie thinks I should continue to take the medication, I hope it will be all sorted. But who knows?
On the tropical island of Sri Lanka, David Lalloo has taken a personal interest in 8-year-old Domindu's care.
He was playing and was just bitten suddenly by a snake, which he thought was about 2 feet long.
David Lalloo and the team identified the snake as the highly venomous Russell's viper.
He was given antivenom, and I suspect that's made quite a difference to his outcome.
After 4 fearful days in hospital, Domindu's father is now preparing to take his son home.
සතුටින් ඉන්නේ දැන්. මෙයාගේ මේ කකුල ඉදිමුදි බයකක් දැන් බෑලා තියෙන්නේ. දැන් අද ටිකට් කපනවා කියලා ડોක්ටර් කිව්වා. මම අර සතුටින් ඉන්නේ දැන් ගෙදර එක්ක යන්න පුතාව. ටිකට් කපලා.
The whole medical team feel the satisfaction of another mystery solved and a young life saved.
I think in tropical medicine we often deal with really quite sick patients and also have a challenge to diagnose what's going on with them. And so when we get that right and they get better and we give them the right treatment, it's really incredibly rewarding. When you see them go home and they're well, that's, there's not really a better feeling.
From snake bites to parasites, at home and abroad, David Lalloo, Bertie Squire and their team will stop at nothing to detect and destroy the bugs, bites and parasites.
It doesn't look very happy.
Cobras are really devastating.
Yes, getting far too close to the comfort. I like to be able to run away. I'm not a huge snake fan as opposed to snakebite patients, but when you see something like this hooded, it's really quite remarkable and quite impressive.